Hey, hello everyone. My name is Gabby Van Dyke, and this is going to be my community project. Okay, so just to jump right in for the intro, I'm from Milwaukee, Wisconsin. I was born and raised here for the past 21 years. We are fairly well known for beer. There's a ton of breweries, pretty much scattered throughout Wisconsin in general. And then dairy products from Wisconsin are pretty well known. And then the Bucks are well known for being the championship holders from 2021. So just to jump right in to my project, one statistic I found was that in Wisconsin, 244,000 adults have a serious mental illness, and then this is from NANI. Another statistic I found that in Wisconsin, 888 lives were lost to suicide, and 231,000 adults had thoughts of suicide in the past year. And that was just from February of 2021, so fairly recent. Um, my project takes place at Harvest Community Church, which is a local church to me. And then the International Community Center was one of the links to that church that they serve. So, for my definition of community, community is an area of people proximal to one space that they share. They may have little in common besides the region of land they occupy, and I said especially Milwaukee, because there can be farmers, college students, liberals, conservatives, whatever you might think of, all living, even in the same building, let alone the same area of land. It's very close together, and there's a big mix of people, so. Okay, next for my windshield survey, I just wanted to talk about a couple of the programs that Milwaukee offers. So first I found the EFM, which is Empower Families of Milwaukee. And this is a long-term home visiting program for pregnant mothers of the city of Milwaukee that provide pre and postpartum health education and case management support. It also provides services that can be provided up to 3 years. And this, all of the information I'm going to be sharing is from the City of Milwaukee Health Department. So next program I want to talk about is the PNCC, which is the program or the Parents Nursing and Caring for Their Child. And this program is a short-term prenatal coordination for Medicare eligible pregnant mothers in the city of Milwaukee in need of prenatal and limited postpartum support. Services can be provided up to 2 months postpartum for moms, and then again, that's from the Milwaukee Department of Health. And then another program was the BOMB program. So that stands for Birth Outcomes Made Better by Doulas. And this is described as a program that serves pregnant mothers in Milwaukee, providing labor and delivery support, birth planning, breastfeeding support, health education, and then up to 12 weeks postpartum support. And then just some information that I learned about my city is I knew kind of the main medical facilities. So we have Froedtert and the Medical College of Wisconsin, Advocate Aurora, Ascension, Rogers Behavioral Health, Select Specialty, Pro Health, and then Children's Hospital. And then within all of those hospitals, they branch into a lot of satellite clinics and other medical facilities. And there's plenty of nursing homes, dental places, orthodontics, dialysis clinics, anything you can really need. Usually all of these things are pretty central, so they are within 20 minutes of each other or 20 minutes of your home, depending on where you live, but for the most part. And then my final point here was that Milwaukee County has the lowest per capita homeless population in the nation compared to similar market sizes, and that is from Winnie Dortch, March 3rd, 2022. So I just thought that that was important to note about my city. I think that does have something to do with the cold winters we have. So, the majority of the year, the homeless population wouldn't really be able to be outside. So next we have the community assessment data, and I just put right on here most of the statistics I found. So I'll just go in order here. 57.15% of Milwaukee County are white or Caucasian. 26.74 are African American, 4.86 are Asian, and then the rest of the percentages were very, very small. So, for example, Native Hawaiian or Pacific Islander were 0.03% of Milwaukee, and that is from the Health Compass of Milwaukee, March 22. So it's very recent. 51.9% of Milwaukee are women, and a little under half here, 48.1 are men, and the median age is 31.3 years. And then over the past 15%, or I'm sorry, over 15% ranging from 25 to 34 years. And then I included a graph in here on slide 8, so we'll refer back to that. In 2019, the county saw 115 suicides. In 2020, there were 126, and in 2021, there were 129, and that's from Taylor Lumpkin in 2022. So this kind of gets into the more basis of my project here, which is mental illness, and these suicide rates and hospitalizations that I'll be talking about are very pertinent to my project. So in Milwaukee County, the adult hospitalization rate due to mental illness was 86.2 per 10,000, higher than the Wisconsin rate of 56.4. So, lastly, I have for 13,000 patients each year, the emergency room at the Milwaukee County Health Complex is the entryway to a system of marked by chronic failure, and that's from Meg Kissinger, 2021. I just thought that that was important to note because I'm trying here my project to, do preventative care with primary and secondary care, like screenings and hotlines and things like that. And unfortunately, the majority of the people who come to a mental health facility are, coming through an ER or an emergency situation. So that was a difficult data to see. So next is my community partners and resources. So my liaison, his name is Pastor Caleb Woodmer, and he is a family friend and a pastor at Harvest Community Church. And then he reached out to Jim Dressner and connected me to him, who is the director at the International Community Center. So he was very helpful, both of them. And then next, I never got her last name, but her name is Caitlin. She works at the ICC. She is a social worker and a volunteer teacher there. And she also has big focus on mental health in the Afghan Refugee Center. So, fourthly, here is a psychiatrist at my work. And she was very helpful pointing out some screening tools and resources that are accurate to a clinical facility or medical-based facility. Next, we have my diagnosis, so I'll just read it straight off here. So my diagnosis was knowledge deficit regarding mental health resources and maintenance among clients of Harvest Community Church and the International Community Center, related to language barriers, lack of education, poverty level, as evidenced by rising community mental illness rates, which includes, suicide rates and hospitalizations. Next, this is where the graph I included, it was the community health plan. So my first goal was, based on my community diagnosis, 100% of participants will score 80% or better on my intervention of the Kahoot game that I provided to them. So my next short-term goal was that 100% of the participants will list or verbalize community resource options within 1 week of teaching. And then lastly, a more long-term goal was that 100% of the community members sought out help for their mental illnesses if needed, or helped others with their mental health. So next we have my interventions. So my first intervention was my main PowerPoint, and that's where I went over diagnostics and screening tools, as well as treatment options, signs and symptoms, and just some other like interesting information about mental illnesses. And if we click into this, we do see I went over depression, which is a mood disorder, anxiety and anxiety disorders, PTSD, seasonal affective disorder, bipolar disorder, antisocial, and then borderline personality disorder, a few eating disorders, and then schizophrenia as well. So also I had, after the PowerPoint, I went over some screening tools. So in that, I had things like the PHQ, which is a screening tool for depression, and then GAD, which is Generalized Anxiety Disorder 7, and that's a screening for anxiety. I also had an anxiety screening for children called the SCARED screening. I had Beck's Inventory, which is another screening tool for anxiety, and then just some other interesting, there's one for burnout, just some other interesting tools. And then when we go into my resources, that's where I had a lot of hotlines and phone numbers. So there's, the Milwaukee County Behavioral Health Crisis Line, walk-in psychiatric room, where it is, the addresses, the numbers for suicide hotlines. And then there's also Title 19 and 18 clinics that accept Title 19 or low-income families, psychiatric services. And then I did just include there's some domestic violence resources, eating disorders. There's a lot of information about just like local resources that are open to helping people with mental illness in Milwaukee County. And then finally, here's my Kahoot game, and that was just 15 questions. Most of them were either multiple choice or true or false, and obviously you need to get at least 12 right to get that 80%, which was one of my goals. So next, for the evaluation for my community health plan, I'll just read this one off. So the evaluation for the first goal was that, as I talked about in the last slide, you need to get at least 12 out of 15 to get an 80% on the Kahoot game, which was the first goal. And then if they didn't get a 12 out of 15, just went over like what the correct answer is, where they went wrong, maybe if they didn't understand the words or whatever it was. So just reassessing their learning. And then the second goal or evaluation for my health plan, what for goal 2 was just asking questions. So even after I presented, I went a couple times after that just to get my hours. And with that, I just asked questions, asked after my presentation as well, just to make sure that everyone's understanding, based on the PowerPoint screenings, resources, Kahoot game, and if I asked them, say, 5 questions, that they could get them all right, and if they can't, then I would just educate them further. And then just to continue on with the evaluations for my third goal, which was the more long-term goal, my evaluation of that was I would have, made a survey to go out to the people of the International Community Center and Harvest Community Church, just asking, based off of my PowerPoint resources, screening tools that I left with them, if they ever sought out mental health. And it would be completely anonymous, and it would just be to see if what I did made any impact, and to evaluate, how much they've learned and how they're using it. Just to summarize, mental health is a prominent issue in Milwaukee, and this is causing other issues. So we see a rise in gun violence, a rise in suicide rates, a rise in hospitalizations, eating disorders, anxiety, depression, all throughout the world, but Milwaukee specifically, I see it a lot in my community. And the underlying issue of this is mental health and the lack of education of it. And I think in our school systems, if we started educating more, or, of people who may not have education options, like people of the International Community Center who are from other countries, Just that education was the purpose of my project, just to help with the mental health crisis of Milwaukee, Wisconsin.